Hello, amazing people. Welcome to my channel. I am Akila, and this is representative of Sync Healthcare Solutions. So what we are a GAPP approved agency that help get your child nursing services needed inside the home. Today I want to discuss the GAPP program. It's a Georgia program. I'm going to discuss what it is and how to qualify. So I'm going to get right into it. So I am going to be reading just so I can make sure everything specifically and all the information you need, nothing is left out. First and foremost, what is GAPP? The acronym is GAPP. It stands for Georgia Pediatric Program. What is the GAPP program? It's a medical program that provides medically fragile children under the age of 21 with skilled nursing and personal care support. GAPP is run by the Georgia Department of Community Health, DCH for short. What is a medically fragile child? A lot of people are confused by this and they're not even understanding if they qualify or not. So I'll give you the definition today. That's the point of this video. So a medically fragile children require either skilled nursing services or constant supervision. Therapies as well, such as physical, occupational, and speech therapies, and or special equipment to enhance, to sustain their lives. All right. And if you fall under that category, you understand that definition. A medically fragile child is a child with a chronic condition or a chronic condition or conditions with an S that requires ongoing medical care, monitoring, and support. Here are some examples. They may need complex medication regimens or medical interventions. They may need ongoing assessment to prevent serious health decline. They may be technologically dependent for life or health sustained functions. They may be at an increased risk for certain illnesses and complications. Some conditions that can lead to a child being medically fragile include premature birth, fetal alcohol syndrome, Down syndrome, cystic fibrosis, cerebral palsy, muscular dystrophy, or epilepsy. A child's degree of fragility can depend on biological problems, their attitudes and behaviors, and environmental factors. Here's how you can get approved for GAPP. Here's the GAPP approval guidelines. All right, so listen up. And if you're someone that is in the process of trying to get your child medical services under the age of 21, follow my channel, like, subscribe, and share. I will be sharing information that you need to get you to the approval process. All right, so GAPP approval. To be approved for the Georgia Pediatric Program, a child must meet the following requirements. Number one, be a resident of Georgia, of the state of Georgia. Be under the age of 21 years old, be eligible for Medicaid, have a medical condition that requires skilled nursing services or personal care support, be currently receiving physician-ordered services. Those are the requirements in order to get approved for GAPP. So GAPP is a Medicaid program where if approved, there will be no out-of-pocket expenses to the parents. It will be paid by Medicaid. The approval process for GAPP can take up to 30 to 60 days. Once approved, the child will begin receiving care immediately. Here's how to initiate GAPP services. Here's what you can do. Number one, you need to verify your Medicaid eligibility. If you do not have it, you need to reach out to Medicaid, or you can reach out to a GAPP approved agency such as ourselves, Sync Healthcare Solutions. Our email address as well as our phone number will be down in the caption, or you can find it in our bio. All right, verify that the child is under the age of 21. Document that the child is respirator or oxygen dependent. Have the child's physician or hospital discharge planner contact a GAPP Medicaid, a GAPP approved agency such as ourselves. If you need to appeal a decision, so say for instance, you went through this process and you were denied, you can also reach out to us, Sync Healthcare Solutions, via our website. Information is in the caption or in our bio, or you can give us a call at 404-800-9513. All right. Now I want to break down a few more definitions so that we're very clear if this is something or information that you can use and to confirm if this pertains to you or not. So I like giving the definitions of things, and that's what the purpose of this video is. So what is skilled nursing care? Skilled nursing care is a type of medical treatment and rehabilitation that requires the expertise of a licensed healthcare professional, such as an LPN or a RN. Okay, a registered nurse or a licensed practitioner nurse. Services that falls under skilled nursing care. Skilled nursing care can include physical, occupational, and speech therapy, wound care, and therapy, and more. All right. Providers. Here are the providers of skilled nursing services. Once again, I'll repeat it. It's licensed health professionals like registered nurses, RNs, and licensed practical nurses, LPNs, physical therapists, and speech language pathologists provide skilled nursing care. Where can this skilled nursing care be provided? Skilled nursing care can be provided through home healthcare services, such as Sync Healthcare Solutions. Once again, our contact information is in the bio or below in the caption. Or reach out to us via phone, email, text here. Let's get started, okay? So what is the purpose? So skilled nursing care is for patients who need medical care or treatment that can only be provided by a licensed professional. It can help patients achieve better health, comfort, and independence in the inside of your own home. So Sync Healthcare Solutions, we're care that comes to you. So some examples of situations where skilled nursing care might be needed include after surgery or injury, right? Like post-operational, like if you got plastic surgery or you had a car accident of some sort and you need assistance. When a patient is well enough to leave the hospital but not ready to go home. When a patient needs around-the-clock nursing care. When a patient needs help with activities of daily living. Brushing your teeth, combing your hair, getting up, assistance going to the restroom, and etc. Feedings, cleaning, clothing, etc. Now, here's the definition. It leads right into personal care support. Personal care support is a type of assistance. Personal care support is a type of assistance that helps people with daily activities, such as bathing, dressing, and eating, so they can remain in their homes and communities. Personal care support can also include help with toileting and bladder and bowel management, attending appointments, using aids and appliances like housework, money management, meal preparation, transportation. Personal care support can be provided by personal care aides. It can also be provided by a parent, right? So a parent can be employed by my agency and receive up to $420 a week just for providing the care to your child. You'll become an employee of the agency, and Medicaid will pay for these expenses and reimburse you for this care, what you're already doing. So if you're also a parent with a child with special needs that may need personal care support that falls underneath that category and the information I just provided, reach out to us. We will be more than happy to help you in that process. So these aides typically provide non-medical services, but some may work with people who have developmental or intellectual disabilities to teach self-care skills. Personal care support is available through Medicaid as a benefit for people with disabilities, chronic or temporary conditions. And that concludes all the information I have for you today. I don't want to keep this video too long, but I want to provide you the information. Once again, if this is information you could use, click like, subscribe, click that subscribe button and like and share this video and reach out to us, and we will be more than happy to assist you. Be amazing. Be great. I look forward to chatting with you soon. Bye.